Hello friends, I am Dr. Prashant Sharma and you're watching MEDICO'S Hub. In this video on dental anatomy, I am going to discuss the question, compare and contrast the morphology of primary mandibular central incisor and the permanent mandibular central incisor. First of all, we'll compare the chronology. First evidence of calcification is observed in 14 weeks in utero in primary mandibular central incisor and 3 to 4 months in case of permanent mandibular central incisor. The completion of enamel or crown that occurs by age of 2.5 months in primary mandibular central incisor and 4 to 5 years in permanent mandibular central incisor. Then eruption. Eruption of primary mandibular central incisor occurs by 8 months, while it occurs at 6 to 7 years in case of permanent mandibular central incisor. Root completion occurs by age of 1.5 years in primary mandibular central incisor, and in case of permanent one, it occurs by 9 years. Now the dimensions. Overall length is 14 mm in primary mandibular central incisor, which is 1.5 times more than that of primary one. Then crown length, it is 5 mm in primary mandibular central incisor and approximately 9.5 mm in permanent mandibular central incisor, while the root length is 9 mm and the root length of permanent mandibular central incisor is 12.5 mm. Then mesiodistal diameter of crown, it is 4.2 mm in primary mandibular central incisor and it is 5 mm in permanent mandibular central incisor. That is, it is comparatively a little wider, but at the cervix it is 3 mm and in permanent it is 3.5 mm. Then labiolingual diameter of the crown, it is 4 meter and at cervix it is 3.5 mm in primary mandibular central incisor, while in permanent mandibular central incisor it is 6 mm, while at the cervix it is 5.3 mm. Now the general appearance. Overall appearance of the crown. So in primary mandibular central incisor, the crown appears to be smaller in size but appears more broad in comparison to its length. Here the crown is larger in size but it appears more long in comparison to its width. We can observe that the length is 9.5 mm and the mesiodistal diameter of the crown is 5 mm. Now overall appearance of the root, it is cone shaped and shorter. It is also cone shaped in permanent mandibular central incisor, but it is longer. If root crown ratio is observed, then length of root is almost double of that of crown in case of primary mandibular central incisor, while here the length of root is 1.25 times of that of the crown. Now the specific features. First is convexity if observed labially and lingually. It appears more pronounced in case of primary mandibular central incisor, while it appears less pronounced in the permanent one. If labiolingual appearance is observed, it is less thick or wide, but it is more wide in case of permanent mandibular central incisor. The mamelons are absent in primary incisors, while these may be present in case of permanent mandibular central incisors. Now these are the various aspects of permanent mandibular central incisor for reference. the facial or labial. This is the cervical line. This is the root, which is very long, and this is the incisal ridge, which is almost straight. If lingual view is taken, we can observe the cingulum, cervical line. Mesial marginal ridge is more prominent in comparison to the distal marginal ridge. This is the lingual fossa. This is again the incisal ridge. If distal view is taken, the root appears to be wider and it is tapering like a cone, and cervical line is less curved incisally and it is curved towards the incisal ridge. Then mesial, this is the crest of curvature. This is the cervical line. It is curved incisally like this. This is the labial outline, this is the lingual outline, and this is the incisal ridge, and cingulum can be observed. In incisal aspect, we can observe the lingual surface which shows concavity. This is the concavity. Distal marginal ridge is here, and here it is the mesial marginal ridge. This indicates the incisal ridge, that is. And labial surface shows convexity. So this is about the compare and contrast of the morphology of primary mandibular central incisor and the permanent mandibular central incisor. Hit the like button, share and subscribe our channel to get the latest updates and notifications.